trabaho man sa baby na sa puti.
Di ay, ato ka lang to na to karon. Hala?
Hala? Ito ko ka po may tuwan. Oo, hindi ko sa ba?
You don't need to eat in secret anymore. I know you feel guilty, but it's not your fault. Binge eating disorder, or what we know as BED, is a serious medical condition caused by complex genetic, environmental, and psychosocial factors.
What is binge eating disorder?
Binge eating disorder is actually more common than anorexia and bulimia and can be associated with many psychiatric disorders. Unlike anorexia and bulimia, binge eating disorder doesn't involve behaviors to limit weight gain like purging or excessive exercise. However, like anorexia and bulimia, binge eating disorder is a condition where people feel like they've lost control over their eating. During binge episodes, people may continue eating despite feeling uncomfortably full, eat large amounts of food even when they're not hungry, or eat more quickly than normal.
Unsa ka giya oy?
Nagkakapag ka?
Gawa ka eh dito ka CR.
Ano nangyari ka?
Bye.
How common is binge eating disorder?
Binge eating disorder affects about 2 to 3% of the general population, making it the most common eating disorder. Studies shows that binge eating disorder is especially prevalent among teens and young adults, though it can affect people of all ages, genders, and backgrounds.
Signs and symptoms.
If you found yourself feeling guilty or eating in secret because you can control your eating, it's important to recognize that these behaviors may indicate binge eating disorder. Other signs include feeling distressed about your eating habits, avoiding social situations involving food out of fear or embarrassment, experiencing extreme dissatisfaction with your body or weight, eating much more rapidly than usual, or eating alone to hide the amount of food consumed.
Risk factors.
Several factors can contribute development of binge eating disorder, such as genetics. A family history of eating disorders may increase the risk. Stress or trauma. High levels of stress, experiences of trauma such as bullying can contribute.
Kaan ka pa. Ano din, kasi hindi gutom na ka ba?
Mukhaon na po sa CR ba?
Grabe na, sige ni Moy.
Cultural pressure. Societal expectations about the appearance or weight may also play a role. Dieting history. People with a history of restrictive diets are more likely to develop binge eating behaviors.
Treatment options.
The first step in treatment is acknowledging that you're struggling with your eating and deserve to get well. A major barrier for many is the fear of being judged or shamed by their parents or close friends if they reveal what they've been going through. Having an open conversation with someone you trust, like a teacher, coach, or family member, can be the first step to getting help.
I have binge eating disorder.
Once you've scheduled an appointment with a healthcare provider, you might wonder what happened next. During a visit, the provider may check your height, weight, and overall health, order blood tests to rule out other conditions like diabetes or high cholesterol. Ask about your eating habits, binging episodes, triggers, and how you feel emotionally before and after these episodes. Based on this information, they'll work with you to create a treatment plan.
Psychotherapy.
Primary treatment for binge eating disorder is psychotherapy, especially cognitive behavioral therapy or CBT, or interpersonal therapy or IPT. The cognitive behavioral therapy or CBT helps you identify and change negative patterns of thinking and behavioral related to food, while the interpersonal therapy or IPT focuses on improving relationships and addressing social factors, contributing to binge eating. Psychotherapy has been shown to have over 50% recovery rate, making it the most effective treatment.
Nutritional guidance and medical treatment.
Working with a dietitian can help you develop a balanced eating plan and a healthier relationship with food. In some cases, medications such as antidepressants or appetite suppressants may also be prescribed to manage symptoms like anxiety or depression.
Self-help and support.
Recovery is a journey, and self-help strategies can play a big role. Joining a support group, practicing mindfulness, or reading self-help books about binge eating disorders can be empowering. Exploring online resources can also provide additional guidance and community support.
Recovery is possible.
Here's an example of hope. One person shared how they struggled for years with binge eating, but with the right support and treatment, he regained control over their eating and self-esteem. They expressed how learning to be compassionate toward themselves was the first step to healing. It might be a long road to get help, but remember, it's not your fault. The first step in this journey is being compassionate to yourself and knowing that you're worth the effort.